I call this meeting of the Brockton School Committee to order, it being December 7th, 2021 at 7 p.m. Please join me in saluting our flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. All right, and to establish a quorum, I know we have one member on Zoom this evening, so I'll do a roll call to establish a quorum, and also additionally, any vote we do take tonight will be a roll call for that same reason. Mrs. Sullivan. Mr. Minicello. Mrs. Mendez. Mr. Rodriguez. The chair is here, and I heard from Ms. Asak earlier. She's under the weather, so we obviously wish her a speedy recovery. And the mayor is unable to join us as well this evening, but sent his regards. He is representing us at a conference. Okay. So the next item on the agenda is the hearing of visitors. We do have two people who have signed in looking to be heard this evening. Excuse me one second. Okay. First is Mary Waldron. Do we have a mic at the podium? There you go. Very good. Thank you very much. You have 3 minutes. The floor is yours. I hope.
Good evening, everyone. For the record, my name is Mary Waldron. I am a resident of the city of Brockton, but I'm the interim president of the Downtown Brockton Association. And I'm here today to extend the DBA's appreciation to the Brockton Public Schools, but moreover to so many of you, not only for being there and pulling it together in 8 weeks, but between the all school jazz band, the marching band, Brockapella, majorettes, the ROTC, those are the ones that were there that day of the parade and the holiday celebration. But behind the scenes were so many of you. I think if Melinda and Lisa got another email from me, Mr. Superintendent, I probably would have been staying after school or something, but I really do want to be able to. I am not the John Marion who's been around for 35 years. John had his first vacation with his wife, and I know I'm running up to another minute, but he well deserved for those 35 years that he put this on. This was put together quickly. The answer was to not have anything was not acceptable. So thank you to you, Mr. Superintendent. I know the mayor in his guidance and serving not only as the chair, but to the city council who have been there. You are all there to support, and we hope that we are able to have another one. We are beginning planning. A debriefing is going to happen next week, and we're going to begin planning the beginning of the year, and we look forward to working with all of you. So again, on behalf of the Downtown Brockton Association, the businesses, the residents in the downtown area, thank you very much.
Great, thank you. And before we call the next person, it occurred to me when I was establishing a quorum, I left out Mr. Sullivan. I'm sitting here looking at the room going, I'm forgetting somebody. So,
here he is at TV.
Mr. Sullivan, you are with us? Anyone hear him? I think you're on mute. Can you hear? Where? Okay. All right, I saw him wave, so I'm going to take that. Okay. All right, I apologize for that. And next we have Anthony Donegan. Please come on up to the podium, and I think you know the drill on this one, so I'll...
Good evening, everyone. It's been a long time since I spoke before this committee. I'm an old alum of, I think, 2012. I was the Ward 3 school committee man, and during that time, I got to know a gentleman by the name of Thomas Minicello. The reason I'm here is I bought him a cup of coffee the other night. He still hasn't paid me back, so no, just kidding. The reason I'm here to speak on behalf of him is it's my understanding that it's one of Tom's final meetings as a school committee person for Ward 1. He'll be moving on as a city councilor. And I just wanted to take a very brief moment to just remind everyone what a tremendous service he's given to the city and to the Brockton Public Schools. I've known him since I became a school committee person, and he took me under his wing. Hopefully taught me a few good things. And I wanted to just say that I know that he's leaving you guys, so he's leaving the school committee in a better position than he started it. I know him as a great dad, a great husband, a great attorney, and a great friend. And I know you guys are going to miss him. And I'm somewhat heartened to know that I work in City Hall, so I'll see him more often now that he's going to be going to city council meetings there. And thank you all for your time. Thank you, Tom.
Yeah, that was really nice.
Appreciate it very much.
Now, how much did he pay you for? No, I'm kidding. You know what? There are several of us that are on the committee and have been on the committee and gone that would certainly have to say the same thing, that Tom took us under his wing and showed us the ropes. And so there's, I suspect, a line of current and former committee members that would say the same and echo your comments. All right. So now, next item, we have the consent agenda. The consent agenda is the bundling of routine school committee business. Any member who feels an item should be taken out of order for further discussion is free to do so. Otherwise, we would just take one vote to handle these items. Does any member of the committee wish to take an item on the consent agenda out? If not, is there a motion on the consent agenda?
Motion to accept the consent agenda.
Mr. Sullivan, was there a second? No?
Second.
There we go. All right, we have a motion on the floor by Mrs. Sullivan, properly seconded by Mr. Sullivan. Before I call the roll, I'll just read the items that are on the consent agenda for the record.
Is that Sullivan squared?
Yes, Sullivan squared. Item A, approval of November 16, 2021, regular school committee meeting minutes. B, acceptance of November 16, 2021, superintendent contract subcommittee minutes. C, acceptance of November 9, 2021, facilities usage and planning subcommittee minutes. D, acceptance of November 9, 2021, security, safety, transportation subcommittee meeting minutes. E, acceptance of notification of personnel appointments, certified personnel. F, acceptance of notification of personnel appointments, non-certified personnel. And G, acceptance of notification of personnel actions, leaves of absences, resignations, retirements. Is there any discussion on the motion? Okay, seeing none, I'll call the roll. Mrs. Sullivan?
Yes.
Mr. Minichiello?
Yes.
Mrs. Mendez?
Yes.
Mr. Rodriguez?
Yes.
Mr. Sullivan? And I also vote yes. All right. Consent agenda passes. Also, could a member of the committee make a motion to take item C out of order?
Motion to take item C out of order.
Second.
All right, motion to take item C, Dr. Richard Herman, out of order, made by Mr. Minichiello, seconded by Mrs. Sullivan. I'll call the roll. Mrs. Sullivan?
Yes.
Mr. Minichiello?
Yes.
Mrs. Mendez?
Yes.
Mr. Rodriguez?
Yes.
Mr. Sullivan? Yes?
This is probably a delay.
Mr. D'Agostino says yes. Dr. Herman, where is Dr. Herman? Oh, there he is. All right, Dr. Herman, please join us. The floor is yours. And again, I want to just say real quick, I once again appreciate you taking time out of your evening to come to the committee and share information with us and keep us informed. You've been doing this with us throughout this pandemic, and the info you've provided us has been invaluable and I can't begin to say how helpful it's been. So thank you again for joining us.
Linda Cahill to kind of give a little bit deeper dive as to what's going on with the kids in the various schools in Brockton. And we'll talk a little bit about the Omicron variant, because I know that's on the monitor. So this is the daily beginning of the pandemic since March of 2020.
For some reason, you might be
Okay. Not good?
it's still attached.
That better? Yes. Fine. Okay. So this is the daily case count from the beginning of the pandemic. As you can see, as you can see, kind of at the tail end, which is the last week or so, we've had a rather abrupt rise in daily cases, so that we're actually now averaging more than 60 cases a day. And obviously that's a big jump from when we were almost down to 0 over the summer. I put the star on it 1 year ago today just to kind of give the depressing outlook that we are today almost exactly where we were 1 year ago today. So one way of looking is that we've made no progress. A sort of brighter way of looking at that is to say that we've vaccinated many people, and hopefully we won't have the same meteoric rise that we had over the winter last time. This is also the year in review. This is how the CDC, this is the main metric that they use in order to determine community spread. And so they look at a case count over a 7-day period. So the 7 days leading up to each day per 100,000, they average that out. And anything over 100, where I've drawn the line there, anything over 100 is considered high community spread. 50 to 100 is substantial community spread. Anything in the substantial or high, the CDC recommends widespread indoor mask wearing and other mitigation measures. So anytime that a community has more than 50 cases per day, or 50 cases, I'm sorry, in this 7-day period, would be considered enough to warrant indoor masking. And as you can see, our most recent count is 457. Again, very, very abrupt rise in cases over the last week or two. This is what our active daily case count looks like. So an active case is someone right now who has a diagnosis of COVID and is in their 10-day isolation period. So there are 616 people right now in isolation in Brockton having COVID, not to count all of their close contacts who are in quarantine. This is what's going on in the hospitals. So we look at cases because that kind of gives us an overview of general spread of COVID in the community. But we also look at hospitalizations and death count, because that's telling us how severe the cases really are. And you can see for many, many months we were kind of hovering around 5% of hospital beds. That's what the CDC likes to see as their threshold, something below 5% of your hospital beds. Anything above 15% of your hospital beds is considered critical, so a critical caseload in the hospital. You can see hospitals right now over the last few weeks have been struggling. So I wouldn't say overwhelmed. I think many people in the hospitals would say overwhelmed, but clearly not as high as 200 case count that we had at the very, very beginning of the pandemic, but very high and getting higher. This is the death toll over the course of the past several months. So 7 deaths in the month of November. As I've mentioned before here, usually the way the flow of the pandemic works is case counts go up, followed a few weeks later by hospitalizations that go up, followed a few weeks after that by death count going up. And so because it takes a while for people to get sick with COVID, they're usually over several weeks. It takes a while also for deaths to be reported to the Board of Health with all the paperwork and death certificates. So I don't want to be pessimistic. I'm hoping that vaccines will prevent the very high death count that we saw early in the pandemic. And in fact, this is kind of, to put it in perspective, way back last in April, May of 2020, at the beginning of the pandemic, very, very high death count. We really did not have any treatments available to us. It was really kind of sort of taken by surprise. This is what the percent positivity does. We, in the city of Brockton, because we're a city of greater than 50,000 people, the Massachusetts Department of Public Health uses a 4% threshold when they're doing their color coding and saying if we're going from yellow to red, anything above 4% for our city would put us back in the red. So anything above 4%, as well as a daily case count above 10 would make us in the red, which is where we are now. I just want to say a word about contact tracing. I'm not going to go over any of this graph at all. This is just what the contact tracers have done every week in terms of breaking down where are the cases coming from and try and break it down into are these family household contacts? Is it workplace contacts? Are they clusters or not clusters? But what I wanted to say about contact tracing is things are changing right now, not only in Brockton, but across the state. So the vast majority of contact tracing done by the city of Brockton was done by the CTC, the Community Tracing Collaborative. As of November 30th, last week, that contract ended, and all of the responsibility for contact tracing now goes back to local boards of health. So fortunately, the city was able to get a $1 million grant to hire some new individuals, epidemiologists and case investigators and contact tracers, to work for the Board of Health. And so now they've started assuming those duties. And the ground rules have changed a bit as far as number of calls that they make, and then a lot of it is responsibility back on the individual, sometimes to do their own contact tracing, to find out the people that they were in close contact with and notify them. And the Board of Health just gives them guidance and direction on how long they need to stay in isolation and what information to share with their close contacts. So that's a changing, evolving paradigm that's shifted right now, not only in Brockton, but across the state. This is today's dashboard. So I wasn't kidding when I said an average of about 60 cases a day. So this was as of about 3 o'clock this afternoon, 72 new cases. Our daily number is 46. And the reason it's so low at 46 is because the state looks at a 14-day average. If we looked at a 7-day average, that number would be closer to 60. You can see 78 people currently between the two hospitals, including 15 very, very sick individuals who need to be in the ICU. And just as a way of comparison, this is the dashboard from last year at this time. So overall, last year we had a total of about 7,000 cases, now 17,000 cases, and you can see for yourself, again, the daily average about the same, 51, 46. So fairly close. At that point, our case positivity, positivity rate was a little bit higher. And for those who follow the red, yellow, green color coding in the community, we've been red for quite a while by virtue of having more than 10 cases per day. And now this Thursday when the number comes out, I think it's going to be closer to 49 or 50 when the numbers come out this Thursday. We're not alone in our misery. We are surrounded by these towns, except for Bridgewater. It doesn't quite touch us, but I've included them anyway. So everyone is kind of experiencing an uptick in case counts. Everybody is over 10 cases per day, and you can see here that...
You ask Mike Thomas if I can call in on Debbie's phone.
You're going to have to mute.
Oh. We good? And so you can see that these are the average cases per day per 100,000. And this is the case percent positive tests in each of the towns. So just to realize that all the towns surrounding us are going up. In fact, because those towns come from we're in such a weird geographic location. We got Easton in Bristol County, and we got Avon and Holbrook and Stoughton in Norfolk County, and the rest in Plymouth County. But if we just look at Plymouth County, where Brockton sits, you can see that the CDC considers us a high transmission area, meaning that masks should be worn indoors in public. And that the number that gets you there is this 424. Anything greater than 100, again, is high transmission. We compare ourselves to the other gateway cities in southeastern Massachusetts, just to kind of keep everything in perspective. Things can get bad, but they can be worse in other towns and other cities as well. So this kind of shows you the test positivity rate in Brockton compared to the other towns, as well as how we're doing in terms of vaccination compared to the other gateway cities. And just to kind of give an overview of who has been infected by COVID, this is kind of the age group over the course of the entire pandemic. And you can see that kind of in the course of the 17,000 plus cases in Brockton, the majority kind of sit in the middle here. But that doesn't tell the whole story. In fact, at the beginning of the pandemic, the average age was, as I've mentioned before, is 51, and it dropped down in the middle of the summer to a low of an age of 28, when really younger people were coming down with COVID. Now, even for the month of December, we're back up to 36. And the reason I'm pointing this out, and we'll go over it in a little bit more detail, is just that as the age group goes up, we had noticed that there were months where very, very few octogenarians, very, very few seniors were getting COVID. And that is because their vaccinations were still effective. Right now, we're seeing that the older folks who were first in line to get the vaccine back in January, in February, March, their 6-month period has now come to an end, and the effectiveness of their vaccine is waning. And so unless they have gotten a booster, their effectiveness of their vaccine is very, very low. And so that's why it's so important that folks, especially in the high-risk groups, including older population, get a booster to really consider themselves fully vaccinated. That's what the first complete month of the pandemic looked like way back in April. No kids were involved. This is the last full month, November, plus I threw in the first week of December. And it's really the under 20 represents the highest bracket of age group that's affected. But you can see that where this had gone down to virtually zero in the fall, in the summer, now starting to creep up again with the older population affected by COVID again. Again, just stressing the importance of sort of following the mantra, you're not fully vaccinated until you've gotten a booster. Okay, and I'm not going to spend too much time talking about kids because Linda will fill us in on the data. This is where we were last time I came to speak with you several weeks ago in October 18th. And this is where we are. This is where we are now, just total. So 2,900 kids total, either confirmed or probable cases. A confirmed case is a PCR test. A probable case is a rapid antigen test. The data is getting a little bit unwieldy and difficult to manage now because there are now so many what I call home tests that are unmonitored. So, at Thanksgiving at my house, I had 14 people over, but no one got in the front door unless they had a negative test at the front door. That doesn't get reported anywhere. And if someone else does that at home and does a positive test, it doesn't get reported to the Board of Health. So we're starting to lose a little bit of data, getting a little bit smudged, but this is the data that is reported to the Board of Health. Again, 9 hospitalized patients, which is where we were last time, and no pediatric deaths throughout the course of the pandemic. And this is just kind of a grand total by school age group, just to kind of get an idea of who's been affected most. I think early in the pandemic when we were doing this, it was mainly high school age kids that were being affected, and now we're really seeing elementary school age kids affected more so. And this is kind of over, again, month by month over the course of the pandemic. These are anyone under 18 who got a diagnosis of COVID. So let me talk a little bit about vaccines. Again, for those who follow the dashboard and the presentation of vaccine data, that is changing too, because now that the vaccine is available to 5 and older, you really kind of have to pay attention when someone says 68% of the population has been vaccinated. Is that 68% of the total population? Is it 68% of the old eligible population, which was greater than 12? 60% now of the new eligible population, which is greater than 5. So these numbers change, and it's hard to compare apples to apples, especially if you have a town that has a lot of kids compared to one that doesn't have a lot of kids. So this is the new eligible population. So of the residents 5 and older, 61% have been fully vaccinated, which is 2 doses of an mRNA vaccine, of a Pfizer or Moderna vaccine, or a Johnson & Johnson vaccine, not necessarily boosted. The state's not reporting yet boosted patients. And then the partial vaccination is someone that's gotten 1 dose of the mRNA vaccine. And this is, I'm not even going to show you just at least 1 dose. These are just fully vaccinated, because at least 1 dose of a vaccine, in my opinion, does not give you protection against COVID. You need to be fully vaccinated and boosted to get your full protection against COVID. So this is by age group as the state breaks it down. And again, the seniors, I think, and I would include 50 and older as well, doing relatively well in terms of completing their vaccination series. And how are we doing compared to like the rest of the country? So this is, the blue is the rest of the country. We're in red, and the green is Plymouth County, just to kind of give you an idea of fully vaccinated folks in the entire total population, fully vaccinated in the over 12 population, and in the over 65. Plymouth County doesn't break it down yet into the eligible population greater than 5, so this is what we can compare it to. And then there are breakthrough cases, and we're seeing more and more breakthrough cases. In fact, in the month of November, I don't remember exactly how many cases total, probably about 900 cases total in the month of November. About 23% of all of the cases, in fact, were breakthrough cases. Now, it is true that they didn't end up, for the most part, although some did, in the hospital and dying. The extent of the illness is usually less severe in someone that's been fully vaccinated, but there's definitely appearing. And so these are the numbers. This is last week's numbers for Massachusetts, because they usually come out on Tuesday evening, and they hadn't appeared by the time I left home. So this is 1 week old, these numbers. But basically, you can see in Brockton, 910 breakthrough cases so far, including 16 that have been hospitalized and 3 deaths. And a breakthrough case, again, is someone who is a positive test result and someone who's been fully vaccinated. Okay, it's time for our classics lesson, but we're going to focus just on one of the Greek letters right now, which is Omicron. So this has kind of been in the news, and it wasn't in the news 2 weeks ago, but at the end of November, the first cases did appear. So we've kind of gone through the Greek alphabet during the course of our pandemic, and now it's all Delta all the time. But that will possibly change in the course of the next weeks to months. Let's skip, we don't want to skip over. So this is where Omicron is now. the sentinel case in South Africa at the end of November, so just a few weeks ago, and how rapidly we are now across the globe in all continents. I think Greenland and Antarctica are spared. These are the states, including Massachusetts, that have reported cases of Omicron variant. Just so, what is Omicron? So I'm going to tell you everything I don't know, because it's just any question you ask me, I'm going to have to say I don't know yet. Let's wait another couple of weeks. But this is sort of a three-dimensional rendering of what an Omicron spike protein looks like. So the spike protein is the bad part of the SARS-CoV-2 virus that kind of latches onto the cell and lets it gain entry of its genetic material into a cell. And all those yellow amino acids are mutations. Those shouldn't be there. They've been changed. They were supposed to be something else, but they are a different amino acid. And in the gray areas are the deletions. So they're supposed to have something there, but nothing's there. So what this does, and we're not quite sure how it works, but it changes the configuration of that spike protein, latches onto a cell more dearly than previous versions, and somehow allows entry into the cell of the genetic material. So I'll go through the questions that I've been asked, and I can answer I don't know to all of them, but I'll give you a kind of an asterisk, I don't know but. So is it more contagious? Probably. It probably is more contagious. And the reason I say that is because it's the area where it was reported first in South Africa, very, very rapid rise in cases. But the jury is not out. It could be that there was going to be a rapid rise in cases anyway, because maybe the country is less vaccinated than we are. Maybe everyone there has already had antibodies to Delta, and but they're not protected against Omicron. So we don't know. Probably more contagious than Delta, but the jury's still out. Does it make you sicker? So are the symptoms more severe with Omicron than they are with Delta or previous versions? And the answer is we don't know. It's not clear yet. There are some anecdotal reports that, in fact, people are less sick, less loss of taste and smell, less people being hospitalized. So even though the cases are soaring in South Africa, the amount of hospitalizations and death are not soaring in South Africa. So yet to be seen. Do the current vaccines that we have protect us? Well, unclear. We don't know yet. In general, the vaccines seem to have been at least partially effective in protecting against all of the variants that are out there. And there's no reason to suspect that they wouldn't be effective, at least partially, in protecting against Omicron. But again, the jury is still out. What about if you've had COVID in the past? Are you protected against the new COVID, the Omicron COVID? And again, we don't know. It's kind of like, think about, I've had the flu in the past. Am I protected against the flu? Well, the flu virus through genetic drift changes each year, and a little bit different genetic variation occurs each year, which is why the makeup of the flu vaccine changes from year to year. And so just because you had flu last year doesn't necessarily mean you can't get a different kind of flu this year. And it's the same thing with COVID. We're just not sure yet. What about the testing that's out there? Both the molecular testing, which is the PCR testing, as well as the antigen testing, either the at-home tests or the rapid tests that we do. Probably they work. It seems like they are effective in finding the Omicron variant. And monoclonal antibodies, sort of the most effective treatment that we have for someone with mild to moderate illness. Will they work? Jury's out. We don't know. Hasn't been tested enough. So hopefully they will continue to work, but it's really these monoclonal antibodies are targeting the spike protein. Very possible that somebody's going to have to re-engineer another set of antibodies that will be more effective against Omicron. So that is what I got. We are still in a fight against the virus. I was hoping that by the time I came to see you this time around, we would have it all in our rearview mirror, but that's not the case. Okay, I'm done. Any questions I'm happy to answer before Linda kind of wraps it up.
Questions from the committee? Okay. All right. Ms. Cahill So are you doing PowerPoint as well? Okay. Then I'll.
Is a, okay, and that's light, okay. Thanks. All right, thanks. Yep. Wait a minute. No, that's not it. School committee. Can you hear me okay? Thank you for inviting me to speak. I really appreciate it. So, I'm going to give you an update on COVID in Brockton Public Schools. So, daily, we check our numbers from Maven. I will download all the cases for Brockton, and then I weed through and separate out the children, Brockton Public Schools children versus non-Brockton Public Schools children, and we look through and see where the cases are in every school, and we notify the nurses on a daily basis. So, I'm going to review the cases, I'm going to explain the testing, and provide an update on the COVID vaccine clinics. So, I always review these signs and symptoms with the nurses on a monthly basis, and we get questions from staff as well. When do we test? Because there's a lot of mild symptoms, but the 4 bolded, we make sure that if you have any one of the 4 bolded, fever over 100, difficulty breathing, new loss or taste or smell, muscle aches or body aches, any one of those you need to test. If you have 2 of the minor, cough, sore throat, nausea, vomiting, diarrhea, headache, fatigue, nasal congestion, if it's not related to allergies or migraines, and if you have 2 of the minor, then you need to test. So, I don't know if you can see that, but as of this morning, from Brockton Public Schools students, we have 461 cases from September 1st, and 116 staff. So, as you see, our elementary students, 223, they're the most. That makes sense because they're not vaccinated. And our high school, 108, because we have the largest population there. So this is just a graph again. Elementary. The blue is the children, and the orange is the staff. So our elementary kids are most affected right now. So close contact definition, an individual within 3 feet, we go with a DESI definition of a positive individual indoors for at least 15 minutes during a 24-hour period, and we have to count back 2 days prior to symptom start date, and if there's no symptoms, it's 2 days prior to the test date. Very important for parents to know that if we have a positive student that is in sports, because we have a lot of children in sports, if we have a positive student that's going to be playing sports, they have to be checked out by a medical provider before they can return to play. So we have this wonderful agency, Cambridge Innovative Center Testing Agency, CIC, that has helped us since September. And it's been a godsend. It's been a little crazy getting all the kinks worked out, but I truly believe we're catching cases much earlier than we would have if we didn't have somebody testing within schools. So we have a three-pronged approach. Symptomatic testing, any student, now you have to sign up for the testing prior to being tested. We cannot take a verbal consent. You have to do it online, or we have written permission in 4 languages in all the schools. We won't test unless we have written consent. So we have symptomatic testing, so if a child becomes sick during the day, or even a staff member becomes sick during the day, they can go down and get tested, but they have to go home. And then we have the test and stay, which has been a godsend. If a close contact of a positive case signs up for this program and they're been identified that day, they can test for 5 days and remain in school, provided that they have no symptoms, and stay in school and get tested and that they're negative. And then we have pool testing, well, it's now called safety checks. So once weekly, there'll be representatives testing in every school once weekly. I myself get tested weekly. I think it's wonderful that we have this program. So we have to discuss about in-school exposure versus out-of-school exposure. If a staff member or a student was exposed out of school, they have to test out of school. So if a family member is positive, they have to test out of school and stay out of school until that test result comes back. Vaccinated individuals don't have to quarantine or test if they have no symptoms, but if they feel strongly that they want to test, they have that option to test. I mentioned about the 5-day test and stay. So this can go over a weekend. Say, for instance, if a student was exposed on a Wednesday, the test and stay will go for 5 days. So it'll go Wednesday, Thursday, and then Monday, Tuesday of the next week. So if an out-of-school exposure outside is, say for instance, they're exposed on one day, that day is counted as day 0. They can test on day 5 and return on day 8, provided they have no symptoms. And we're always monitoring for symptoms for 14 days after exposure. Any symptoms, please stay home. And if they're symptomatic in school, they must go home. And again, while you're awaiting a test result from outside, do not come to school. Again, no verbal consents. We have the electronic and we have the paper in 4 languages. It's right on our website. There's a little circle that you can click on, and just and it's instantaneous. Once the parent signs on, it's instantaneous that the team will get it and they can test right then and there. So if a staff member becomes symptomatic during school hours, if they want to get tested, they can. But they need to call Human Resources to let them know that they have to leave. And of course, they have to notify their building principal or their immediate supervisor for coverage. So for testing locations, I do have a link in here, but you can just Google COVID testing in Massachusetts. We're still testing at Massasoit Monday, Wednesday, and Friday from 7 to 11, Tuesday, Thursday, and Saturday from 2 to 7, and that's drive-through. You don't need an appointment. A couple months ago, there was nobody there, but my brother went and just got tested on Saturday, and he said there was 100 cars deep. So it's heavy. We also testing at all the various pharmacies, and also Brockton Neighborhood Health Center is testing as well. So I had mentioned about the pool testing. Any positive pools, we get notified within 24 hours. It's typically that night. I'll get an email, the principal will get an email, the nurse will get an email, then the team comes out the very next day, test everybody in that pool. We try to keep the pools small because we don't want so many students affected and staff affected. I mean, we try to keep them to like 5 versus we can have up to 10, but. So they'll test everybody in that pool. They'll find the positive the next day. Now, there's been several instances where the pool has been negative the second try, but then the team will come out another day and test them the next day. So as of today, consents for test, I'm sorry, as of the 4th, consents for testing were 2,228. staff 974. We keep trying to get more people signed on. We do it through our website. Jess is sending out an all-call today, social media, so we're trying to get more people on board with the testing. Oops. So total tests done as of today, 4,850, 100 positive from September, 31 positive from December. So December, we're only on December 7th, so we're in a definite surge. So vaccination, we have 586 students with 1 dose of Pfizer, 1,525 with 2 doses, 11 students with 1 dose of Moderna, that's 18 years and older, 1 student with Johnson & Johnson. Staff surveyed, we have 1,232 vaccinated. Now, do I think these numbers are 100% accurate for our kids? No, I don't, because we have an electronic health record that interfaces with the Massachusetts Immunization Information System, which we sync regularly. But if our electronic health record is off by 1 letter in a student's last name, or a space, or a hyphenation, it's not going to sync. So I think our numbers are probably greater than that. We've asked that families bring in vaccination records on a continuous basis, and we're constantly trying to get information on vaccination status. And I would like to see our numbers greater than this. So some of the hotter spots, we're trying to hit those spots first. So we have 2 vaccination clinics set up for this week. Gilmore, which is December 9th, 2 o'clock on up. Could be 2 to 4, 2 to 6, depending on pre-registration. It's for students, families, and staff at that particular school. Again, we have one on the Angelo School on December 10th, 8:45, again for students, families, and staff at that school. We're going to have more to be scheduled. The Vax bus was at the parade. We had 34 students, Brockton kids, vaccinated during the parade. And if you want to get a vaccine, you can go and check out Find a Vax online and register. They're doing them at the Shaw Center, various pharmacies. The Shaw Center is a regional center for vaccination. And we hope to have more in the schools as well. Advice to families, students, and staff: stay home if you're not feeling well. Please don't come to school. Please don't come to tryouts. Test the whole house if there's 1 person, 1 case. Don't return to school until verifying your results, and notify your school nurse if you're positive. Daily, I notify the school nurses of their positive cases, but in turn, I also ask them to notify me, and I'm going through their logs several times through the day to see if they're getting positive, so I can add that to our list. And we have to report this to DESE I report it on a daily basis. Relay to school staff and Board of Health if your positive student is in outside activities such as daycares, sports clubs, etc. And of course, we're going to recommend vaccination. This is one of the mitigation strategies, and this is the only way we're going to get through this is trying to vaccinate as many folks as possible, wearing our masks, staying home if you're sick. And are there any questions? Oh, right, great.
All right.
All right, thank you so
Any,
much.
Any questions from the committee for either Dr. Herman or Mrs. Cahill? Mrs. Mendez.
Students are waiting for a test, and it takes, like, if they're symptomatic, and it takes 5 days for them to wait. What's occurring with attendance?
I'm sorry?
Like, a lot of students, you said if they're symptomatic, right, they have to do a 5-day wait. Like, they won't be able to come into school until after 5 days that they're tested, correct?
Right, and then they have to wait till day 8.
Yes.
If they're negative, they can return. But that's if they're not symptomatic. That's a close contact. That's a close contact. So if they're an outside close contact, they test on day 5. They can return on day 8 if they have no symptoms. If they're positive, they have to stay out until day 11, and their symptoms have to be better. That's when they can return.
Is there an attendance, is there anything having to do with attendance for
They
that?
would notify the school, and those days get waived. They ask for work.
Okay.
So, yeah.
And then the pool, right? So you mentioned how students are getting tested in a pool of what, 5 or 10, is it?
Typically, we try to keep them small. We break it up in the schools. We try to keep staff in one pool, students in another. And typically, the pool is like 5.
So if, let's say hypothetically, which you mentioned that it has occurred, if someone's positive, then how is that communicated to students?
If somebody's positive
In that pool, how is that communicated to the students?
How
And
is
I'm
it-
thinking about anxiety levels, like.
So if there's a positive pool, they'll have the pool come down again, and then test everybody in the pool, and that positive will go home. And then the close contacts of the positive can do the test and stay for the 5 more days.
Okay, and
Okay.
those 5 students that are being retested to see who's the positive one, they don't get communicated like
The
why
parents will,
they're getting retested?
yeah, the parents will be let know that there was a positive pool, and then they'll be retested, because we want to be as transparent as possible with all the parents. So.
Okay. All right. And then I guess my question is to Dr. Herman. So he mentioned how you're not fully vaccinated until you get the booster shot. And as of right now, the booster shot is only approved it's still not approved for our students' age group.
Right, so when I meant to say that, for those that are eligible to get a booster, okay, those that have gotten a full, the 2 series and are still within 6 months, they are considered fully vaccinated. I'm just saying personally, my own feeling is that if someone is eligible to get a booster, in other words, it's been 6 months since their Pfizer or Moderna shot, that they really need to get that booster shot in order to raise their level of protection, because their level of protection has fallen off so much after 6 months that I don't consider them to be as fully immunized as they could be. So that's why I feel. Obviously for kids, who are not there yet, even adults who got their series within the last 6 months, they are considered fully immunized. I just want to stress that it's so important for people that have gotten their second shot to get their booster if it's been more than 6 months.
And then do you, this booster shot as of right now, do you think it's going to be something that's going to have to happen every 6 months to continue to keep the effectiveness of it?
So I think it's a big, I don't know. A lot of it is going to depend on what Omicron does or any future variants. It's pretty easy to see this becoming endemic. So just part of our life from now forward, just like the flu is, and that it may be that from time to time, the vaccine, the structure of the vaccine is going to get modified to try and be more effective against whatever the current circulating strain is, and that we'll be getting, vaccines on a regular basis, whether that's 6 months or yearly, that I think it's really too difficult to predict.
Okay, thank you.
Any other members of the committee? Smith, I'm glad you asked that, because that was one of my questions. It seems like this is ultimately got the potential to end up like the flu, where we're getting flu shots every year, we're getting COVID shots remains to be seen.
Yeah, I wonder if they'll combine them.
I know at the beginning of this, and I was just curious as if this is even still a thing, they talked a lot about a thing, herd immunity, right? Which was, had it, got over it, had antibodies, or got vaxxed. Where this thing keeps mutating, is that even a thing anymore?
Well, it is a thing, but it's becoming less of a thing just because the new strains continue to appear, and it's not so clear that we develop a herd immunity to the new strain. Right. So it's still a thing, but you'd have to develop a herd immunity to the new strain. And right now, kind of it's virus 1, humanity 0,
right.
Just in terms of us being able to keep up with it.
Seems like it's always one step ahead of us, unfortunately.
But the vaccine, does prevent, or at least, seems to be quite effective in terms of preventing serious illness and death. So even if you do turn positive after being fully vaccinated, it's not as likely that you're going to get real sick and end up in a hospital. So it's so important. That is the most important mechanism that we have to protect against COVID right now.
Okay, great. Anyone else? All right, well, thank you both so much for being here. And Linda, I want to thank you too. I know I've thanked the doctor, but you also worked on the city side and throughout the summer and throughout this whole pandemic and went way above and beyond your normal responsibilities, so we really appreciate it.
Yeah, and I just want to echo that. I mean, there's nothing good about dealing with this pandemic, but one of the good things for me has been working with Linda. And I know you know how fortunate you are as a city to have her working, but she is just tireless, a great teacher, very dedicated, and really has put in an enormous amount of effort. It's been really, really good for me to work with her, and I'm really, sort of proud that she's a member of the team in the city, taking care of all of us.
Yeah, well, very proud of her and her team.
Oh, thank you, thank you. Thank you to the nurses, too.
So thank you all for the work you're doing.
We appreciate you both and everybody who's been involved. We certainly owe a debt of gratitude to many people who have been involved in managing this, but certainly Dr. Herman and Linda Cahill for sure. So thank you.
Thanks, Doctor.
All right, well, I think at this point it's the report of the Superintendent of Schools, so Mike, the floor is yours.
Thank you. We're going to bring up old friend and former mayor of the city and current, obviously, Councilor at Large. Councilor at Large Moses Rodriguez is here to make a pleasant presentation on behalf of the Cape Verdean Association. So it's great to have you back with us.
I came for the food. Thank you, Mike. Thank you, Mr. Superintendent, Mr. Chairman, members of the school committee, folks from the school department, some folks from the community that are here. I'm honored to be here on behalf of the Cape Verdean Association. I mean, when you hear the issues that are taking place with this virus that's affecting us, it's something serious that we need to take seriously. One of the things that we've been doing since April at the association has been conducting some vaccination clinics as well, because we deal with folks that are, don't speak English all that well, and to make it a lot easier, we conduct vaccination clinics with the help from the folks from the health department here in the city, from that Board of Health. They do it every Thursday from 2 o'clock on, and I think we've gone over 1,000 folks have been vaccinated through that clinic as we move forward. And this is just since April, the end of April, that we started this thing. But the reason why I'm here today is basically often we don't do a great deal of tooting our own horns for the work that gets done in this community. We often see nothing but the negative most of the time when we hear people talking about the negative issues. And I'm here tonight to basically speak on a positive side of things, and to basically thank the superintendent, the school committee, the school department, the entire BHS family on behalf of the Cape Verdean Association. As you know, we've been around since 1977. We are, the Cape Verdeans are the largest ethnic group in the city currently, and the organization works with that population and also the various immigrant groups that go through our doors in a sense. And we have for the last few years developed this real partnership with the school department, helping us with a variety of programs that we do. The school has been instrumental in the summer programs that we run in the early stages of the COVID issues here in the city, when many organizations were conducting virtual summer camps, virtual camps. We actually were able to do live camps with the help of the superintendent and the school department. At the Angelo School, we had provided summer jobs to about 29 technically Brockton High School kids. and we provided a summer camp experience to over 100 kids, and this was in 2020. This year, we had 42 young people that we provided jobs for. 99.99% of them were kids from the Brockton school system. I think we had one kid from Wareham that just kind of lives in Brockton as well. But most of them are from our system. And we had over 100 and I think close to 200 little kids through that summer program. We're currently conducting the after-school program at the Gilmore School that we do every year. And again, I'm here to express publicly our support on behalf of the entire community. This isn't just from the association standpoint, but from the entire community, because we've got kids, you know, Cape Verdean kids, Hispanic kids, Haitian kids, Brazilian kids, you name them, going through these programs. And often they're not spoken for, and I'm here to speak on their behalf and just thank you for the work that you've been doing. Thank the school system for the work that you're doing, going through some real hard times dealing with the health issues that we're dealing with here in the community. But I wanted to make sure that it doesn't go by without any recognition. So what I did, I think I came last month, but I ate the sandwich that belonged to Melinda, so she took me out of the agenda for the last month, because I think it was Aldo's fault, because he told me I could have her sandwich, and when she came down looking for a sandwich, there was nothing left. So I was bumped out of the agenda. So luckily I was put on the agenda this time. See, things don't change, you know. You know, it's that old saying, you can take the kid out of the ghetto, or you can't take the ghetto out of the kid. Well, that's me. But I'm here anyways to make this presentation to you, Mr. Superintendent, and also the chair and the members of the school committee representing this system. Let me pop this open and see what it says, because I don't remember. It was so long ago. But I have this this beautiful plaque, and I hope that you display this at Central for folks to see. That again is from the Cape Verdean Association. It says, with our greatest appreciation to the Brockton Public School, in recognition for your unwavering support to the association and to the children of Brockton. And it was basically dated for October of this past year. At least it's this year, right? But I wanted to make sure that on behalf of our organization, on behalf of the children of Brockton, that you'd get this and you display it proudly, that we do appreciate deeply the work that's done within the school system, within the professionals that call themselves members of the Brockton Public School System. So thank you very much for all that you do, and please continue to do the great work that you do.
I just want to add that Councilor Rodriguez and I speak often. He is a champion for all members of the community, especially the young ones. Always has been. And when he's been doing this long before the pandemic, but people need to understand that when you go through hard times like we've had with this pandemic, it's the community partnerships that the school system needs to have with their community partners to really get through the tough times. And the Cape Verdean Association has been a great partner with the Brockton Public Schools. They do as much for us as we do for them. And it really is helping us get through these hard times. So it's very much appreciated.
Thank you. And, I'll add just that, again, this is how we get things done as a community in Brockton, right? The community groups and the school district and the city overall working together to make sure that, we're serving the needs of our residents, and in this case of the students in our city. So thank you very much to the counselor for coming and for presenting this to us.
Yes. It's great. Next, we're going to invite up Miss Susan Lordy. She's going to make a presentation for it's of a mural that she is proposing. She's been working with the mayor's office. It's a mural that is proposed for the outside of the Downey School, and she's going to present. Is it for up here or just? Yeah, well, oh, all right. I'm going to shut the lights off.
All right.
she's been working with the mayor's office on this mural. It's part of a grant that came through the mayor's office, so obviously school committee approves any murals that go onto buildings, so I wanted to make sure she took a look at this for you. Yeah, we can do it after, okay? I know I forgot about that.
Hear me? Can you hear me? Yeah, there we go. Okay, so my name is Susie Lordy. I'm the founder of a 501c3 here in Massachusetts called 24 Hour Power, Inc., and we do unique art forms that began with something called Recovery Graffiti back in 2018. Since then, we've done a number of projects with the City of Champions, including Tukas Playground. We do a lot of work with the mayor's office. We do a lot of work with the Boys and Girls Clubs, the Old Colony YMCA, Brockton Christian Mentoring Youth Initiative, the Shannon Grant. We're a part of that. And what we like to see is a combination of working with youth and artists to create new landscapes, especially for the City of Champions. We never stopped, even during COVID-19. We found a way to incorporate our artwork with the school systems, whether it be dropping off art supplies to a central location at the schools or the Old Colony YMCA, for example, and then the parents would pick up these supplies and bring them home and let the kids still participate when they were home. And then they could come on Facebook Live and show some of the activities that they did. And it just gave them a feeling of being able to stay involved and included during a very desolate time. So I'm very proud of the work that we were able to do with the City of Brockton during the pandemic, and we continue now. So you don't just keep staring at this blank wall. Now I'll explain what this is. This is Downey Elementary School. This is the front entrance of the building. And what we're proposing here is, and my artist Jessica Picanza, this is our Brocktonian that would be leading the artwork for this particular project. What we're proposing is gorgeous diversity artwork at this location. As you can see, the different languages in the welcome right under the awning for where you go into the building. And then the 3 R's that Downey stands for: responsibility, rigor, and respect, with their mascot. You know, they love the Downey duck. And so that would be some very bright, eye-catching, just a really nice touch, especially when you're talking about the 50th anniversary of the school, and there really isn't any artwork going on the outside here. So if you were walking into the building, this is the first thing you would see. Over to the next slide would show, that's a 108-foot wall, okay? And that's if you were parked in front of Downey School, that's the wall that you would see, in addition to where you go under the walkway to get into the building. So that 108-foot wall would now in turn look like, and this is my favorite, this is diversity on steroids. And it is so beautifully created that I'm at a loss for words looking at it. It really encompasses everything that the city would want. It represents different ethnicities. It's an all-inclusive school as it is, so this is perfect, in my opinion, and in several others that have seen this right now. What I want to point out is the bottom part there, you see all those different colors. What those are, they represent the handprints of the 600 children that attend this school. So we figured out with a 108-foot wall, and it's nice and low, each of the kids, no matter what size they are, can come out there and put one hand in there, and they can be a part of this project as well. So it's a way to incorporate the youth with the artists. They can be speaking with our artists and learn some tips on how to do this amazing graffiti artwork and these murals. And yeah, we're very excited about it. I'm just curious if anyone has any questions regarding this, or? Sure.
This looks like an awesome idea. Just if you go back to the welcome, I just want to know what languages those are that you have.
I believe we had Cape Verde. It was whatever Terry McIntosh recommended that she wanted. I believe she said she had Creole, she had Portuguese, and that's not on the mural yet, right? This is like no.
Okay.
This is just an example. We can change this to have whatever you want there. We can have the word welcome in as many languages as you want.
I was just wondering about the spelling.
Okay.
I think Creole is spelled wrong. But yeah, I know this is just a draft, but
this is a draft.
We don't want to spell it wrong and then people come in and right away, that's now a problem.
No.
But this looks great, and thank you.
Absolutely. And like I said, we're open to suggestions. So if there are other colors that you'd like to incorporate in this, or other words, but we just thought the word welcome itself is probably our best bet to go across the front of the building. And like I said, we're open to as many languages as you'd like to have in there. Those were the ones that were recommended to us to just put in for this initial draft. Anything regarding the rest of the artwork that anyone's interested in?
Just say that this and the next wall, I mean, it's absolutely beautiful. You have just your normal brick, right, that we're all used to walking up to, and then to walk up and, see this very welcoming, and, it's really nice. And I like that the duck is there, and so there's the school pride piece right when you walk in. We're also, two birds, one stone there. And then this is just absolutely gorgeous. For me to think of, I'm happy I can draw straight lines. For me to think that you're going to paint this on a wall is just amazing to me. And I love that you're going to incorporate all the kids into it and get them involved. Really just a nice project. And I know I appreciate, and I'm sure the rest of the committee appreciates that, you're willing to do this and bring this to us. Mrs. Sullivan.
I'd like to thank you, Susan. I'm actually a friend of Terry McIntosh, and I know she's been working hard on improvements for the Downey School, and I've been working with her. And also, I would like to thank the mayor's office for working on this too, because I know they've been in close contact about this project.
Yes.
I'd like to thank you too.
And this is my artist. I don't want to.
No, you don't want to.
She would be the lead for this entire project. She is a phenomenal artist, and she's from Brockton, and her name's Jessica Picanzo.
Oh, well, thank you, Jessica.
We do a lot of work at BCA as well. In fact, she's doing the holiday windows over there right now. So we're busy in the city, and we'd like to stay busy, especially on a project of this magnitude. This would be huge for us. And it would tie in nicely with the playground that you all are proposing for that area as well.
Yes. We have been working for quite a few years on a special needs playground for this school. And so this school the Downey School has a big life skills program in it. So the playground will not just be a regular playground, it'll be a playground that students in wheelchairs can access the playground also. So it will cost a little bit more than a regular playground for a regular school. But this way, all the children are included. And the diversity is great on this. And, they've been working for a long time, so hopefully we can get it done. Thank you. And I'd like to thank you very much.
Thank you. Yes, sir.
When I first look at the picture of the Downey School currently,
Yes.
you know, and you look at it, you say to yourself, just a lot of brick there. And then, you know, you look at the pictures with the artwork, and you think about, you know, a child driving up, you know, on a bus, you know, or with their parents, and looks at this school, and then looks at the same, and then looks at this school. Which one do you think the child's going to gravitate to, or feel comfortable with, or get excited about, or you know, to say, I want to be in this building, or I want to be in this building? Well, I don't think there's any choice. I think, you know, any adult or any child is going to want to be a part of this building than something that looks like that, just a plain, drab, old institution. You know, so I think it's great. With a little tweaking, we certainly can work out, you know, whatever details need to be worked out. That's a minor issue. That is wonderful right there. That is fantastic. So, congratulations.
Excuse me.
How will we make sure that
What I was going to suggest is that maybe we can work with you guys to make, you know, a few changes, like the right words and all of that. And our meeting on the 21st, come back with a final draft, and then the committee can vote on it.
Yeah, that's great. That looks beautiful.
Don't they need a vote tonight?
Sure.
Don't they need a vote tonight on this?
Oh, I mean, is it, can it wait till the 21st, or is there some urgency that has to?
No.
Okay, yeah,
No,
no, so we're fine to
absolutely.
vote on the 21st then.
Okay,
Yeah, we'll take it up the 21st.
it's okay.
That way we have a final draft that we're voting on rather
Absolutely.
than.
Yeah, well, we want to make sure it's all
So
spelled
then
right.
meanwhile, just so I'm clear what our role is, we will get with Melinda, I'll get with you, and then I'll get the correct spelling and any words that you may want to have added to that. And then Jessica, I'll give it to you, and then you can put your magic on it, and then we bring it back to you on the 21st? Is that?
Exactly.
Is that how it, okay.
If you have it earlier, we'll send it out in the Friday packet, so the school committee look at
Okay,
the Friday before the 21st,
okay,
and then they can vote on it then.
wonderful.
Yeah.
Thank you so much. Thank you for
Well,
your time.
thank you,
Thank you.
and Jessica,
Appreciate it.
thank you for sharing your amazing skills with us and with the Downey School.
And also, I just wanted to say one more thing. I would really like to thank Terry McIntosh, and she is the president of the CPAC group here for the Brockton Public Schools also. So I just want to make sure that we, you know, give her thanks.
Yep. No, and
She did a lot of hard work on this.
well, and I know you and Terry work hard for the Downey School, and you know, I've been trying to work on this playground for some time and fundraise for it. And I know late Mayor Carpenter gave some money towards it too at one point. And
Yes.
so the efforts for the Downey School go back many years. And
Yep.
I know you're trying to work hard to get to the finish line on that, because it'll be a wonderful thing for the students there, as will this. I mean, if all of that can get done, you know, for the students at the Downey, it'll be really nice, you know, with the mural and the playground and everything. So anyway.
Thank you, Mark.
Anyone else? Oh, Tom.
Just a quick reminder, this is the site also, the Field of Dreams, the Little League Field of Dreams, where Mayor Carpenter raised all sorts of money and funds to provide the city of Brockton with a first-class Little League, you know, baseball field. And it really is a nice addition to the city for playoffs, for welcoming other, you know, towns and cities to a field that is, you know, a really nice quality field, and highlights what the city of Brockton's all about, which is certainly a tradition of sports. But this is just going to, you know, add to that site and building, so that it really, together, it's really going to be something, and a really welcoming place for our children and our students. So it's a win-win for everyone.
Well, and it just adds to how important our schools are to our neighborhoods, right? I mean, this is going to be such a nice thing for the neighborhood around it too, as it already is with the fields. But, you know, when we get all of this done, you know, it just, again, you know, will be such a nice thing for the neighborhood. And really, again, my other point of just how important every school is to the neighborhood around it, and can be such an important part of the neighborhood. And, you know, so Anyone else?
Mrs. Sullivan.
The Brockton School Department, because I took a tour of the Downey School at the open house, and Principal proudly took me around, and the school looked amazing. And I'd like to thank the head custodian there. I think his name is Neil.
Neil Kellum.
Because they do an awesome job. I swear you could eat off the floors.
Yep.
It was so clean. So I'd like to give a hand to the staff there.
Great.
Thank you. So next I'm going to invite up Dr. Ethan Cancel and Dr. Ethan Zakowitz. We're going to have a report presentation on our student-specific group data, and then follow up with the implementation of the focus areas to address the MCAS data. So Ethan is coming up first. And Ethan, I'll get the lights ready for you.
All right, does this work? Amazing. All right. Good evening, everyone. Thrilled to be here. I only have 50 slides to get through, so we'll take our time and be done before midnight. Okay. Thank you. Thank you. Just for you, Tom. So tonight, we will cover why we're looking at student-specific groups. That is a new term. Trends over time. We're going to look at comparable urban performance. We will talk about how easy it is to misanalyze data and why it's so important to guard against it. Pay attention to this one. That to me is the most important message for me tonight. And then probably the most important message that Sue and I are going to give you will be her presentation when we get into the actions that we're taking as a result of our analyses. So very quickly, I may refer to these as SSGs, so I can appear to be very cool, student-specific subgroups. This is state-defined, deals with race and ethnicity, economically disadvantaged, which we call ECODIS, English learners, and students with disabilities. So that is just a glossary of terms for you. Why look at the student-specific groups? So that's pretty easy. We want data to inform our decisions for all students. It's possible, when you take a closer look, that policies can have different impacts on different groups of learners. That's why we take a look. Some cautions, which you've heard before from a previous MCAS presentation. It is, or it was, a pandemic year. There is less precision than usual. The students took half the test, and please keep that in mind. You also had some students taking the test at home, remotely, some people taking it in person. Student-specific groups can be small. You always want to be cautious when you're dealing with small groups. And the student-supported groups are self-reported in some cases, and in other cases it's how, if you're in a state database or not, so it's not always the most accurate. And again, you're going to hear this time and time again, generalizations and stereotypes can be fed by SSG membership and improper analysis. So we're going to be aware of that and do our best to avoid it. This is a really important question. So how big of an impact is being in a student-specific subgroup? Like, what's the impact on test scores? Well, here's the bottom line. I used some pretty sophisticated statistical analysis, and pretty much it said 30% of the ELA and math scores can be explained by memberships in either the economically disadvantaged, the English learner, or student with the disabilities student-specific group. So if 30% of it is explaining that means that 70% is not determined by the student-specific subgroup membership, which means, and this is going to be a really important message, what we do in the classroom and how we deliver our education really makes a huge difference. All right, just very, very quickly, because I told you I have a lot of slides, I really wasn't kidding. This is just a reminder. You can see that overwhelmingly, 60%, almost 61% of our students are in the African American student-specific group. Next largest is the Hispanic or Latino group, and you can see the percentages. I don't have to read them to you. Also, it's noteworthy that about 70% of our students are in the economically disadvantaged group. We've got roughly 24% English learners and 18% students with disabilities. So that's just to sort of set the table. Big part of tonight is averages tell only part of the story. We'll come back to that. Here is a joke to make you remember this point. If you put your head in the freezer and you put your feet on the fire, on average you feel just right. Obviously that's ridiculous. No, you don't feel just right. Averages hide a lot. Okay, please be very careful. We will be talking about averages, but they hide a lot. And those are not my feet. I don't have a pedicure that nice. Thank you. All right. The first, the first economically disadvantaged. So here we go. These are the scores. The orange is for ELA. Blue in the center is for math, and the green is science. It's important that I point out that for the ELA and math, I'm giving the average for the district for all grades, but since there was no biology last year, we're doing science only for grades 5 and 8. That's the way it works. So you can see that I don't know if you can see because we try to put all these slides on, you can see that there are almost 10-point differences between if you're economically disadvantaged or not. Now remember, that's an average. It is not the only. So for English learners, we're going to see a somewhat similar, although the gaps are larger. The students who are in the English learner group tend to score lower on an English test. Imagine that. But there you have it. So you have a 21.6 point gap for ELA, a 17.4 gap for math, and 19.4 for science. Students with disabilities, still large in terms of the gap, 17.6 points for ELA, 15.7 points for math, and 14.3 for science. These are the different groups that the state determines. There are a couple groups that I did not include because we have so few. You could probably guess who these people's scores are, so we would never include people like that. There are rules. But for the major groups that we have, you can see that there are actually really large distances. It's about 20 points. It's a little bit less, but it's about 20 points between the top scoring group, which just by chance happens to be the Asian students, over the African American students in ELA. On the math side, it's a similar, slightly larger. It's a little more than 20 points. So those are the averages, and that's important to point out because they're averages. We'll get back to that point. That's what I think in the entertainment world they call a tease. In the literary world, it'd be foreshadowing. Comparable urban achievement. Oh, don't know what happened there. So if we go, okay, here we go. If we go all the way back to 2008, 2008 is when the MCAS first was tested in all grades. If you look at the same 9 large urbans that we are most similar to, so that's Brockton, Boston, Fall River, Lawrence, Lowell, Lynn, New Bedford, I can't read any of those, but I've memorized them, Springfield and Worcester. You can see that we are the red color on the orange. So we are, in 2008, the highest of the 9 in ELA. In a couple years later, in 2011, we're second highest. And in 2014, we're in the middle. Now you could say, why, oh why did you pick these years? 2008 was the first of all grades tested. 2014 was the last year that everyone was taking the MCAS. After that, we took PARCC, or some took PARCC, some took MCAS, and then after that, we took MCAS 2.0, except high school didn't. These are the CPI statistics. The CPI was on a scale of 0 to 100. So that's where we were compared to our peers back in the day. You can see, though, it's a slow process. Unfortunately, it didn't head in the right direction. This is math, the exact same years. You see a somewhat similar outcome. You see that we started second highest, then we were down towards the third from the bottom of the group. And although we improved a little in 2014 in terms of our CPI, our relative standing to the group did not change. Okay, so now you might say, why are you looking at grades 3 and 8? This is 2017, 2018, and 2021. I wanted to put in 100 slides, but I was told I wasn't allowed to. So to condense it, 2017 was the start of the new MCAS. But the high school didn't take the new MCAS then. And the high school wasn't necessarily taking computer-based. They were, you could take paper longer there. So what the state basically does is it says, well, 3 through 8, they did take the same MCAS the whole way through. High school's a little different, so I said, that's great, I will just split it out. And it's a very similar story no matter what you're looking at. And so we're not comparing apples to oranges. We have similar groups. The bottom line here is in 2017, we were the lowest. 2018, we were the lowest. And in 2021, we are slightly higher. We are the second lowest. So in the pandemic, it's not that, the pandemic was this unique event. This has been a long slide, and in fact, that was the argument we made. There was real substantive damage caused by the underfunding. So this is not a one-time event. Same story in math. This is for all kids. You can see the progression. And now you take a look at the exact same group of schools and say, well, within these student-specific groups, how did we do? Because it's theoretically possible that you'll have different outcomes. But it turns out, no matter how we looked at the data, the results are stunningly similar. And this includes Marie Lafort looking very closely at the item analyses, grade by grade. There were almost no differences. So as the economically disadvantaged students did, so did the English learners, the students with disabilities. Where we taught the particular standard or skill well, we did all right. Where we didn't teach it particularly well, we didn't do all right. And the gaps were very consistent, very few changes. But here we are. Economically disadvantaged ELA, grades 3 through 8, we're second to the bottom, which was exactly where we were for the entire group without a student-specific group. I don't know what's going on with this. In math, we are, for the economically disadvantaged, slightly lower, one place lower, not much. For science, we have, third from the bottom. English learner, ELA, second from the bottom. This is an interesting one. This is ever English learner. because this one, English learner, means you're presently an English learner. If you were ever an English learner, so you may have shown up to the country, learned how to speak English very well, and now you're, leading the pack, you would be in the ever English learner category. So we're right where, it's very consistent, that's the point. English learner math, and ever English learners, a little bit lower. It's not really substantially different. Here it is, English learner science, and here it is, ever English learner science. So again, slight changes, but not, I don't know what's up with this clicker. It must be the person who's doing it. Students with disabilities, ELA, third from the bottom. And here we are with math, second from the bottom for the students with disabilities. And again, same thing. And here we are with science. So this is supposed to be an arresting image which wakes you all up and makes you say, aha, I'm so glad I don't have a job like that. The danger of misanalysis, we've talked about this. This is a true statement. If you look at the ELA scores by race, the Asian score, the Asian group of students score, let me say that the right way, was the average score was a 497.0, and the African American students scored 480.3. Those are the averages, and as I said, roughly speaking, 17-point difference. Okay, that's true, but so is this. And this is important to think about, because if you take the top 100 scores in the city of Brockton, this is the top 100 in the whole city of Brockton, and you just take them all and you take the students and which groups they belong to, which racial and ethnic groups. The average, the highest average, is for the Black or African American group of students. That's not what you'd expect just looking at that. This is why it is so important that we don't make these sweeping generalizations based on averages. There's a lot of variation inside a group. This was surprising to people. This is also the case. If you look at the top 100 scorers, these are actual students. Now, I did it as 100 just to make it really easy. Anyone can calculate the percentage. Yes, it's true that our African American students constitute the largest group, 60%, but they're also overwhelmingly the largest group of students in the top 100 scores. That is hidden in an average. So before you jump to conclusions about, before anyone jumps to conclusions about averages, remember there's a lot of variation that an average hides. So I thought this was a good quote for a numbers guy to tell you. The numbers will never tell the full story of life on what life on earth is all about. So please beware of the single narrative. Do not say that there's only one message to take from this presentation. And if you consider how those averages hide things on a test that was given remotely in person during a pandemic, I think it's a much smarter strategy to build on the assets that the kids are bringing, the strengths that they are bringing, because they are bringing strengths. So I want to sum up, and this is a brilliant visual pun where I'm going to pass the baton to my esteemed colleague, but just to sum it up, there is a long-term negative trend for the district and for the student-specific groups. Averages always hide substantial, well, maybe not always, but averages have the capacity to hide substantial variation. In our case, it is substantial in performance, and we must be vigilant not to overgeneralize. And the thing that will really kick us into the next part of the presentation is the student-specific group membership only accounts for 30% of the scores. Okay, so that means we have a lot of area in our control that we can do something about. And Dr. Zakowicz is going to tell you what we're doing about it. So do this.
This is the baton handoff moment?
That is the baton handoff.
Oh, that was so fast, Tracy. Awesome. I can tell you one thing that I'm sure everybody's thinking as you're watching what Ethan just shared, and I say this as a, like all of you, someone who was educated by the Brockton Public Schools, a Brocktonian, and we don't ever want to see ourselves at the bottom of any graph or chart, and we are fighters. And so my part of this message is, Ethan just shared the numbers with you, and we need to know that. That's no question about it. That's part of how you move forward. And my part of this is going to be to show you how we can make that data actionable. You don't just accept it and say, oh, well, too bad. And so how do we go forward? And the message is, what we do from this point forward matters, and it matters a lot. So let's look at this. And Mr. Minicello always asks me this question, so I want to start with this. Like, what does the research say about the impact of us as educators? So let's start with the most important group, the teachers. Teachers, this happens to be through the RAND Corporation, a think tank group. So teachers matter more to student achievement than any other aspect of schooling. This goes well beyond, and this ties into what Ethan just said. Teachers' impact goes well beyond socioeconomic status, class size, technology, curriculum, services, facilities, even leadership. It's the most important group. And teachers can account for 33% of student performance gains in 1 year and can add almost 4 months, 3.8 months of added learning a year. That's powerful. So how about the principals? Because those are the two big groups in school buildings. So what does the research say there? Well, the principal's effect is not quite as large as teachers on average, but the principal's effect is realized across the school, where a teacher impacts a classroom. So both are vital in student achievement. Leadership is second only to classroom instruction among all school-related factors that contribute to student learning. And so, as compared to the teachers, principals account for 25% of student performance gains in 1 year and can add 2.7 months of added learning in a year. What we do matters. And in fact, how about us in the central office? How does the district play out? And it's important and it matters. Leaders, starting with district leadership, the school committee, the superintendent, all of us on his team, ensure, first of all, that schools pursue a severely reduced number of initiatives. And number two, select and focus on only the most urgently needed, evidence-based instructional strategies. And what does that mean? It means that focused leadership, doing less and doing it better. Asking the question, what is essential for schools? And the answer is far more purposeful reading and writing in every discipline, or what's called authentic literacy. Now, how do we stand in that? Well, the superintendent has been clear this year in his focus. He has 3 focus areas, and our job is to carry them out. Focus on effective instruction, focus on active reading and writing, and focus on positive relationships. And those have been pushed in the schools. The teachers have been working hard to see these happen. So thought what was really powerful is for you to see what it looks like. And that's what I've been trying to do each meeting. And, and you'll see what do these 3 focus areas look like. But what has the district done? Because what the district sets the plan, really. And so already, the district has implemented a Brockton Public Schools lesson plan template that teachers are using because planning is essential. We have a walkthrough tool. Ethan mentioned Maria Lafort. Maria is working as an instructional leader with everybody, and she has teams of people from the schools, from Central, constantly doing walkthroughs in the schools to see what's happening. And also, objectives are being posted and talked about and shared in every classroom. And why is that? Why does that matter? It matters a lot. And it matters that they be standards-based, grade-level learning goals, written in student-friendly language, explained to students so they understand this is what's most important. Kids need to know what they are learning, how they will learn it, and how do they know it. And why does that matter? Again, it's about what the research says. They need to know, it's essentially what they know and be able to do, and it should be written in student-friendly terms. Students will be able to, or students will understand, or the best way of all, when a student says it, I can. Why does this matter? And it matters a lot. It's an objective is the learning target. And guess what? It's hard to hit a target you can't see, right? So the teacher needs to make the objective clear to the kids, and the kids then know what the learning is. So, and why is this? Let's talk about the research again. A meta-analysis, and a meta-analysis is when the research has pulled together all of the studies done on a certain subject. Found that, and this is Marzano, is one of the sort of gurus of education research. This is powerful. I mean, think about this. When people ask, why are we doing this with objectives? This is why. When students were clear in advance about what they were learning, their achievement was on average 34 percentile points higher on tests used in these studies than students in the control groups. So why would you not? This is the kind of thing that has to be recognized. It matters. What we do matters. So what does it look like? And now this should be something where you say, okay, Ethan's data was upsetting, depressing, whatever, but that's the baseline, right? What we do matters. So what does it look like? So I send out an email to the principals and I say, because we're in the schools all the time, so what does it look like? So one of the focus areas is active reading and writing. Let me show you what it looks like in the George School right now. It's active reading. They have an acronym RACE: restating, answering, citing, explaining, and summary. Sum it up. And you see, these are the students' words. We also are trying to constantly supplement with rigorous grade-level appropriate work. And so a student shouldn't be facing an MCAS prompt. They shouldn't face it for the first time when they're sitting to take an exam. So teachers are using these all the time in their classes. So this is in grade 5. I learned about scorpions when I was putting this together. I didn't care for scorpions, but I read about them. But it's also in math. Now, look, I love what the teachers are doing. They're teaching the kids the appropriate discourse, the appropriate talk. Grade 4 math talks and collaborative problem solving. And you can see what's being laid out. Now moving to the Hancock School. This is effective instruction, standards-based active learning in math. I'm going to show you, this is what the objective was. Students measuring in inches and feet, comparing their measurements, and so forth. But look at the objective, how clear it is. I can measure in feet and inches. That's a good student objective. They're defining it. I will know I made progress when I can compare an object in inches and feet. That's a target a kid can see, and they can sure get there. That's what's most important. Now look at what it looks like. Isn't that awesome? This is the best part. The best part of our work is when we're in schools. And they are working on that. Now let's head to the middle schools. At West Middle School, this was some active reading and writing being done in a writing center. Now these next few slides I'm going to just put up because I want you to see how messy active reading is and writing. It is, it's thinking, writing is thinking, so you'll see the kid thinking through. So now they're planning it out. Then they're writing it out. They've got the rubric, they're measuring themselves against the rubric. It's messy. And then we go to the PLUF. Another middle school. So what do the focus areas look like there? So we have grade 8 ELA students evaluating each other's literary analysis in a gallery walk. So they're displaying their own work for each other. How about science students supporting their arguments with evidence? Social studies. This is a transitional bilingual education class, bringing language to life. And then how about this real-life math student? Let's figure out, calculate the percentage of students who earn Term 1 honor roll average. At Brockton High, this is an example of how they're using, this is where leadership matters. They use their December faculty meeting to how to provide feedback on instruction and implementing lesson planning. And you can see how they're really using their time wisely. And I'm going to finish with this one. This is all schools. So think about some of our pathway schools. This matters for all kids. What we do matters. So this one is terrific. I want you to show, they're using their faculty meeting at the Keith. It's how the teachers are first teaching themselves, which they will then teach to the kids. Because it starts with the adults, right? So here's what they're going to do in this is, and they're modeling, look how they're modeling the practice, the objectives. These are teachers, I will become familiar with effective student engagement activities. I will become familiar with effective formative assessment tools. I will become familiar with strategies that will help students assess what they read. They are going to model what they are then going to teach to the kids. And the activities they're going to do, they're going to learn how to do a jigsaw activity. Now, I won't go into the details of this, but it's an engagement strategy where kids learn to break up, they chunk the material, and they teach each other. How do you learn something best? When you have to teach it to somebody else. And so it's a great activity, and then they're going to show another activity called Everybody Writes, and I'll show you what it looks like. So first they taught everybody the jigsaw activity. I won't go through all the steps. You get the picture of this, how they did that. So the teachers went through the activity. It was modeled for them, so they will then use it with their own students. And then they moved to activity 2, which is called Everybody Writes. This is a fabulous activity that works well for all kids, but especially, this ties right back to Ethan's presentation about the student-specific groups, because I'm going to ask you to recall 2 of the groups were students with disabilities and our English learners. And when you think about those students, sometimes, what is the typical dynamic in a class? Teacher asks a question, kids put their hands out, teacher calls on the kid. Well, if you're an English language learner, you sometimes need a little more time to think before you have a chance to put your hand up. You're still processing the language. Or the same might be for a student with disabilities. Everybody Writes means I ask you the question. I say, we're going to have a fabulous discussion on whatever it is, but before we talk, everybody's going to write first. So then it puts everybody on the same playing field. Everybody has a chance to think first, and that's what they were learning to do. I write to know what I think. It's a great way to talk about it. Benefits of the strategy, here's how it works. And then the teachers made a commitment to try this. And then what does it look like? So everybody knows exactly what the look-fors are. And they have even brought the walkthrough tool to say, this is what the expectations are. This is when we walk through what we expect we will be seeing. And then they just finished it up with questions. So on that, I conclude by saying what we do about all of that data you just saw matters, and it matters a lot, because we will make progress, because this is exactly what's going to happen in the classrooms, from the central office leadership to the school building leadership to the teachers in the classroom every day. So both Ethan and I are available for any questions that you might have.
All right, members of the committee, questions, comments? Mr. Minicello.
So with regard to the lesson plans, I think that's really an important piece. You know, the lesson plan really is basically your instruction, your instructional resource or guide as to what you want to accomplish that day for the class. And what the class needs to, I guess, really grasp the concept and or the lesson before the teacher, moves on to the next section or what have you. I mean, you have to be confident that the kids are building on the foundation that they need to learn today in order to go for tomorrow, and teach for tomorrow. So,
Right.
So do you feel that this sort of this uniform approach is having, I guess, buy-in and an impact for the future to improve those scores?
Yeah, I surely hope so, and here's what I'd use as evidence of that. At our meeting today, at our executive team meeting today, Maria gave us a report on summaries, and we're going to share this with the principals tomorrow, summaries of the walkthroughs. And in walkthrough round 1, you lay out what the look-fors are, what you see. She's now in the middle of round 2, and her comment was that we're seeing changes and improvement. And you hit on a key thing, Mr. Minicello. It's lesson plan. I mean, about anything you do, you should plan it out. Right. And so it's just about a thoughtful progression of the class. You say, yeah, are we seeing it? You bet. And so do we hope there will be impact? Not only do I hope, I believe there will be. It has to be. I mean, it's the right thing to do, and we're seeing, and what we're seeing is people are working hard every day, and it brings about a consistency to the process.
And I agree with you in terms of, you look at the numbers and you're not happy about it, but you have to acknowledge that that's the current state of affairs, and
right.
You can't just sit there and wallow. You have to say, okay, it's time to pick up and implement change and do what we need to do to get to the other end of the spectrum.
Well said. That's right.
Well, thank you. Appreciate it.
Mrs. Sullivan?
Thank you for your presentation. It was very interesting. It was a great presentation. I really like the objectives, like in the school I'm working in, they have them on the board, and then the kids read them back.
Good.
And I
Good.
think
I love hearing that.
We're doing that too, right?
Right.
Okay.
Right.
Great. I love that because they never did that when I was in school, and I think that's really important. The kids see why they're learning this.
Right.
So I really like that part.
I'm glad you said that because that's.
So thank you.
Yeah.
It looks like a lot of hard work is going on.
It is.
So that's really great to hear. Thank you.
Any other members of the committee? Mrs. Mendez?
Microphone. Yes, I agree. Presentation, awesome. Just like the research, the why, everything. I have a question first for Ethan. So I noticed that you're right. Like I teach my students too, like the data doesn't tell the full story, right? So I love that emphasis. But then when I looked at the cities, when you made the comparison of the gateway cities, just like from math to science to ELA, I noticed that our percentage is not that bad, right? It's like literally like the percentages the percentile is like less than 10 when we compare Brockton to like New Bedford, who was pretty high, and I think it was ELA. So I guess my question is, what are these cities doing differently? What are they doing that we could do that we could either get where they are or even higher? And then even when we were compared to the state overall, it wasn't a huge percentile difference either. It looked like it was less than 10. Correct me if I'm wrong.
No, you're absolutely right. I think that Dr. Zakowicz is better equipped to answer what we're doing. I can tell you that when you look at the Marzano research, it's, what's your line? It's simple, not easy.
Simple, yeah. Change in education is simple. It's not complicated. We know what works, but it's not easy because it's doing it that's the hard work. Simple, not easy.
And so when you ask, what are they doing? The Office of Learning and Teaching asks that. I think that one of the things that the walkthroughs and the planning tool, they're tools to make sure that we're doing the things that we know will help us. And it's just that relentless monitoring and just doing it. Everyone knows how to be healthy also, exercise and eat well. But, you know, you got a bag of chips and, you know, some Snickers and the game's on, and, you know, the next thing you know, you didn't get enough sleep and you ate all that junk. You know what to do. It's the discipline to do it. And that's where the tools and the leadership has to come in.
And I also think that one of the things we're seeing in the schools, which is just so positive, is the, and you'll hear everybody saying this, that, you know, when Mike kicked the year off with the focus areas, it gave everybody a common vocabulary, a common mission. You know, that's no small thing in a district. We were on a call today with, for some of the work, because we are trying to ask all of those questions. How do we accelerate learning? What are the things we can do? And one of the things they said to us was how they were surprised, because most often they're talking with districts that don't have that kind of focus. She said, everybody just seems to be on the same page. Well, I think that kind of gets everybody on the same page. But then, as Ethan used the word relentless, I think that's the key, is getting everybody to keep moving in that direction.
So then, to follow up on that comment then, so it sounds like the great work that you presented here is being consistent across the schools. So are teachers being able to share? I know usually like CPTs allow you to share in the school, right? What is the great work you're doing in your class? But is this any way being communicated across like middle schools to have consistency, across elementary schools? Because what's working for one school might be working for the other.
Exactly.
So is that communication being like communicated effectively across the schools?
Not enough yet. That is like you just hit the nail on the head. It was like you were at a meeting today on the Zoom call, because that's what is happening. It's almost like people are starting to feel some confidence and some, you know, some strength in what's happening. And you know, when you're feeling not good about what you're doing, you're not really interested in sharing. Now there is that building, and that was exactly the conversation we had. And how do we bring this about? And of course, the greatest challenge of all for those kind of things is the time. That became our, you know, okay, so where is the time for that to happen? But I think you're exactly right. It has to happen, because it can't be in pockets in one school and not in another. I just keep coming back to what the district review said a million times, that we had become a district of schools, not a school district. And I think this, like the focus areas of the superintendent, the work that's being done is about being a school district. It's about all. So you're exactly right on that. We have some work to do on that. We're not there yet.
Sorry, I love this stuff, so that's why. Well, it's what I do, right? But the walkthrough's purpose, so from my understanding, it sounds like the biggest purpose right now is for changes and improvements.
In instruction,
And instruction. But once you're obviously seeing the changes and improvements from the data that you show, especially from just literally posting that objective and having students internalize the objective. What would be like the next step for that would be a visual change or improvement when you do these walkthroughs again?
Good question. One of the most difficult challenges we'll have, because we are seeing those kind of things. We are seeing objectives everywhere. We're hearing teachers talk about it. There's pushback. I mean, with all change, when you're asking people to do something that they haven't done before or they haven't done for a while, why do we need to do this? What is it? When are we going to have time to do this? When does this matter? So when that happens, it has to always be the why. It works. We know what works. Let's do what works. But here, those things are sort of the first steps. What you're hitting on is the more difficult. Here's what our biggest challenge is going to be. Moving the rigor of the work to grade level standards, especially, and we try not to use the pandemic ever as, I mean, everybody faced it, so it's not unique to Brockton. But we also know the truth of that is the gap was widened. There already was an achievement gap here. It was widened by the pandemic. So getting grade level standards is a much more challenging issue, because it's talking about the complexity of reading and the teaching of that. So that will be a much harder challenge for us. But you know what? I keep saying you can't go 0 to 60 in a second. You keep building on one thing to the other to the other. and it will be continuous. But that's going to be a much harder one. And student engagement activities, by the way, too. The other thing I think we're struggling with, also I suspect pandemic related, is the glued to the computer screen issue, and
not knowing how to socialize. Yeah,
exactly. In fact, in the next meeting, Sharon will do some more with again pushing with positive relationships. We just didn't want to make it too long at one time, so she's going to do that at the next meeting.
All right. Well, thank you. I hope this energy is contagious, because you guys seem passionate just by talking about it. So hopefully you keep that energy up and continue to be the role models. And
thank you for saying that.
Ethan, I think you were going to say something.
Oh, I was going to say that if you listen to Mike and Sue and Maria, one of the things that you'll hear them talk about with the grade level rigor, that you asked, what are the next steps? Grade level rigor, higher order thinking, and this one is the big one. And it's funny, you know, Mike is like, it can't be the teacher talking all the time. When Sue talks about engagement, that's code, meaning we need to have the students doing the work and doing the thinking. Teacher already knows the content. And so those are the sorts of things that harder to do, but when we're out, you know, looking, that's the sort of stuff, when we see that, that's when we'll know the change is really happening.
And by the way, everybody's been on the walkthroughs. In fact, you know, Mike goes on them, the central office team goes on them, and then at the school, it's the principal, the various members of the principal's team, the coordinators. Not all at once. Can you imagine the poor teacher if an army of 12 people come marching in? No, I mean, we plan it out so that we're not all showing up at one time. But and here's the best part of that, and you would love it. You know, it's the debriefing talk where the change really starts. You feel it because people are talking about it's not about individual teacher evaluation. That's not the purpose of a walkthrough. Nobody mentions anybody's names. It's about what do you see consistently. Ethan mentioned too much teacher talk has been a constant struggle. And so that's something we need to work on. That's what the debriefing conversation afterwards is fabulous. It's so around, you know, how do we improve? It really sort of holding the mirror up to us as a district.
I just want to see any other questions. Mr. Sullivan, I didn't want to leave you out. I know I can't see you, so. Nope? No, I'm fine. Okay. All right. Sounds good. Mr. Minicello, did you put your hand up again? Yeah, okay.
I mean, you basically hit on something that I think many of us in the school committee have noticed for years, and that is there needs to be a consistent framework throughout the entire district, because that's what when you just said that, you know, we're a district of several schools, but yet, you know, the schools need to have a solid structural framework that is implemented, you know, at every single school, and so that there is consistency of instruction, of delivery, of curriculum. I mean, I use the middle schools as an example because it's a little easier for me to just, you know, point it out. What's being done over here, there. It's pockets of everything, and it's not. It's for years. It's been, you know, and for years, many of us, you know, not just me, have said, what's happening? You know, if you take a kid out of West and throw him in over at this place, it's not going to be the same.
You are exactly
and I'm
right.
not saying that it's not going to be a little different here or there. Of course there's going to be differences, but I mean, and maybe I'm over-exaggerating because I'm not there every day, but it just seems to me that in order to succeed, you have to put in that framework, that structure that the entire district abides by. The entire, you know, this is the playbook. This is the Bill Belichick playbook. You don't mess around with it. Okay, you want to mess around with it, you're getting traded. Okay, you know, consistency. You're not an individual here. You're on the team. Okay, you know, and that's you know, that in order to succeed, I think in a district as big as this, you can't have everyone doing their own thing in all these different places. I mean, I'm sure there's going to be customization because we have so many subgroups. And that's the other thing. You have to have the consistency. But now, how are we going to get that curriculum, that framework into this subgroup, into this group of kids that come
right.
from this area. It's got to be the same framework, but delivery might be different.
Correct.
But we're going to have, they're going to all know the same
Yeah,
thing, you know?
that's right.
So, I mean.
And that's the skill of the instruction around differentiate.
Right, I mean,
it's exactly what you're talking about, differentiation, scaffold. I mean, those are the challenges, no question.
I mean, so I'm glad that we, you know, in order to improve, you have to recognize what the issues are. So now that we know what the issues are, you know, I know we can do it. Brockton will do it. It's just a matter of, I think there has to be that consistent framework throughout the district so that everyone's building on the same thing. You know, we have a solid foundation. Yes, there'll be something a little different here, a little there, but it can't be so vastly different. It has to. We have to be, you know, a solid.
This is what we stand for.
A solid foundation. You know, at every school, it has to have that same sort of a philosophy of how it's going to be implemented, how it's going to be done, and then the whole district is going to be pretty much, you know, stronger and rise up together as opposed to this school is doing great, this school is doing this, this school. No, we all got to be on the same foundation, and we're using the same building blocks, the same materials. But you know, you might have, you know, a foreman over at this site who has, you know, a bunch of, you know, Cape Verdean children or a bunch of Haitian children. So now we need to tweak a little bit. You know, we need, you know, that we're all going to learn the same thing, but we need to figure out how are we going to get it to these kids? How are we going to make it work for this group of kids? But we're teaching them the same thing. You know, they're all going to know how to do this, this, and this. It's just a matter of, okay, well, how do we deliver it in an effective way?
Right. That's right.
Yeah, so, okay, well.
Well said.
Okay, great. I'm glad we're all on board.
Any other?
Onward and upward, as they say.
No, I just want to thank Ethan and Dr. Zach. Tomorrow I'll go on my 4th walkthrough, and you can see the change, and you can really see how hard the teachers are working. It's a lot of hard work, especially coming back from a pandemic. And you know, I go into elementary schools and also, you know, they are working very hard, and they're focused, and, you know, again, dealing with the after effects of COVID, but, you know, the hard work going on in the classrooms is evident, and you can start to see the consistency and amongst, you know, obviously the support staff as well with the paras and MTA, so, you know, you can really see it when you go into classrooms and walk around, so I look forward to, I'm doing 2 more this week, and it's great. It's just it's great to get into schools and see and spend time with the teachers and the kids.
If the rest of the committee was done with comments, I actually had a few questions and comments myself. So don't run away yet. So a couple things, and my colleagues all touched on some of the same things that I was thinking, but. So, obviously, you know, we all have to understand that, I mean, this is kind of like turning the Titanic. It's a huge district with, you know, this is not a small district with 3 schools, right? So we are turning the Titanic here, and what I will say that I appreciate is, in the past when we've seen these numbers, right, it's been don't panic, and as I've said in the past, by the fall of 2019, I was panicking, and I know I'm not the only one. What is nice is, okay, it wasn't a pretty show. But what are we going to do about it was also here. Instead of here's the not so pretty show, and I think that's been lacking is, and here's the plan, here's the roadmap, here's what we are going to do and what we are doing. And I also appreciate you showed examples, because I don't think we've seen that kind of in school, here are examples of we're doing it.
Right.
So I wanted to just say that I appreciate that very much, and it is
we'll keep them coming.
Right, no, and please do. I mean, granted, you know, I'm only going to be here for one more meeting to see it, but I'm sure that the folks coming in onto the committee will certainly appreciate to be able to see the actual work too, as well as the remaining members. But so I wanted to ask, because I've heard about the walkthroughs, and you know, obviously there are some folks, like you said, change is tough, and there's some buy-in, there's some resistance, and the walkthroughs are something I've heard about, which I don't think is a horrible thing at all. But can you talk about those a little bit in the context of maybe staff members who are, I don't know, I guess feeling a little intimidated by them, like, what they're really about, and then tell us a little bit about the debrief. So the debriefs are always wonderful. Can you share a little bit about those?
Sure, absolutely. And again, I'll start by saying the intent of a walkthrough is never about a personnel evaluation. In fact, on our own note sheets, there's no names even there. It's about taking a look at instruction across the school. What are things that we're seeing that are getting at the focus areas? It's really around the focus areas, so that like effective instruction, active reading and writing, positive relationships. So we're always looking for that. Now, here's the thing about a walkthrough. The more it's done, the less intimidating it obviously becomes. And interesting, you can kind of tell in schools where a principal in the team had already just done it anyway, because kids and teachers don't even respond. In some places you can see it's been a newer experience, but what happens is that you try to keep it to a relatively small team of, like between 3 and 5. You just don't want more than that, because then it's like the parade coming in. But you can come in at any time during the class, so that's understood. Right. So there are some things that are on the walkthrough tool that talks about entrance routines. Well, you don't see them. You came in the middle of class, so you don't look for those. Or you come in at the beginning, you don't see the end. That's also that's fine. So thinking about the focus areas, we have some things that we're looking for, which teachers know, and then after, so the walkthrough is probably around 10 minutes maybe in a particular class, sometimes less, sometimes more. Sometimes if you see something, they've started a test or something, you're like, people just walk out. But one of the best things is, and Mike was getting in, we often talk to the kids and say, you just go over to the kid and say, quietly, while they're working, show me what you're learning today. And so here's an example of a really good suggestion that's been coming out of walkthroughs. We're seeing a predominance of kids on computers, no surprise after the pandemic time. But what we're pushing for now is that whenever a computer is open, there needs to be paper and pencil and something to write with as well, because it's too easy for the distraction to get by and they're not following up. So that's going to be, a walkthrough gives you something that you see that you're really happy about, and you say, let's keep pushing for this in all schools, sort of get to Mr. Minicello's point, like consistency. But it also can reveal some things, if we ask people to focus on this. So for example, Heather Ronan is our math coordinator. And we're implementing a new math program at the elementary schools, and it's been a challenge. And so one of the things I have heard Heather say on any of the walkthroughs that I've been with her, or just in general, she'll go up quietly beside a kid and she'll just say, or to the teacher too, sometimes, and say, remember when the computer's open, there needs to be paper and pencil as well. So things like that. And then the debrief, it's really a good time for the school leadership team that we always start with, what did we see? And then now in round 2, we're saying, we begin the debrief with, here's what we talked about the first round. Now, what did we see that changed? Where do we go from here? Right. Another is to get at what Ethan just mentioned. One of the things we're going to try to address in the second and third rounds of them is higher order questioning. Teachers are doing a lot of work on getting kids reading and writing. Now, if we can raise the rigor of the question a teacher asks the student to do when they're reading something, that will help bring things up. So it's a step-by-step process.
Right. Okay. And then, I've heard a little bit about this from teachers, and then one of the comments was that there was a comment, and I do recall it in the review, about basically not rushing through curriculum. And I know we have pacing charts. Right. On certain curriculum, and obviously, this committee has talked about a lot about, we need to make sure the kids in every school are, at the same pace, basically. So I understand the concept of having the pacing chart, but how are we balancing not rushing and keeping everybody on the same track?
I know, it is absolutely a challenge, and there is no easy answer. I wish I could just say, the answer is. But I can tell you what we're doing. We're working with a group. DESE has been a good partner in this. For any time Mike and I are constantly talking with them, but whenever we've needed something, they've provided support. So I'm going to tell you what we were both on today. We talked to them about just that issue. We said, how do we provide these supports when, because what they're telling us is, you have to accelerate the learning, and teachers are facing just that challenge you're talking about. And so we said to them, we really could use some help for us on showing us what this looks like so we can then help teachers see what does this look like. So they've partnered us with a group called TNTP, and it's about learning acceleration and providing what they call just-in-time supports. And Mike, myself, and a team, we've got a team of 4 elementary, middle school, Michelle Connors is representing the middle schools, and Carrie Kopp is representing the high school, and myself and Mike. And we are, now it's, what is it, a 6-part series, Mike? I forget. It's a multi-part series, and that team is then going to develop, hopefully, some training and sharing of methods for other teachers as well. Because you hit on it's a real issue, and it's not an easy one.
Right.
So it's challenging. But we keep tackling one thing, we just keep, my theme is moving forward, we just keep moving forward in something, we'll try to do one more thing.
Right, and sometimes you implement something and you start to do it and go, geez, this isn't working quite as well as we'd hope, let's tweak it a little.
Step back, I know, we've had plenty of step backs sometimes, you're exactly right.
That happens.
Just as the data person, not the instruction person, it's really nice for me to hear and listen to the expertise of people like Sue, like Maria, like Heather, like Candy, Candace McGann at Math Middle School, Jody, now we're going to have a new reading person. It's really nice to hear yes, it is absolutely true, and I think of my personality, I like to talk. It's really hard for me to get through stuff. Mike's like, no kidding. But you hear something like Sue. So Sue will say something like, when you're a teacher and you're going to hand out your papers, you're worried about getting through your material.
Right.
When you're handing out your papers, you know where your kids are sitting. Why are you walking all over the room? And it's just like those little golden gems that if they're shared with teachers, when you have leadership sharing that with teachers, it's still going to be a challenge, but you've saved that amount of time. And so there are all these efficiencies and ways that you can do this better, that just-in-time supports. It is hard work.
It is.
But there are ways to do it.
Right.
And you mentioned, I forget if it was you, could have been Mr. Minicello, but something about the word buy-in. And I will say to you, in all the time I worked, when we were at Brockton High and we implemented the literacy initiative, and then we shared that because we were asked to share what we did with some other schools. And the question I got most often was, how did you get buy-in? And my answer is, you've gotten to know, it's candid, right? If we waited for buy-in, we'd still be waiting. Buy-in comes with results. People will implement because you're asking them to and you're supporting them through it, but it will be when we see results that finally people will say, oh, okay. And there's always there are always, you think about the big 3 groups. There's the group of people that you ask them to do something and they would run through a wall for you and let me try it. And then there's the big middle who's like, oh, yet another thing, are we sure, is this going to work? They'll be convinced when they see results, and I get that. And then there's a small cadre of people who will never buy in. It change is difficult, and why do we have to do this, and so forth. But it's about the kids, and it's about achievement, and that's what we just keep our eyes on that prize. That's what matters most. It's not about us, it's about the kids.
Absolutely. So my final thing, and I apologize that I've kind of taken a bit of time here, but is, you talk about you have your 3 focus areas, which obviously makes sense, and even, out in the real world in business, right? I own a business. If I threw 15 initiatives at my team in 1 year, they'd, we'd never hit any of them because we'd be running in 15 different directions. Yeah. So just in any type of organization, whether it's a school district or otherwise, that makes sense. Yeah. But what I was thinking about is, and I say this makes sense, but we saw these turnaround plans just about a year ago. They were very elaborate, very detailed. with many different goals. Like, so have those been changed? Have those kind of been scrapped? And this is the, this is
Good
the
question.
replacement?
Not scrapped at all. People did a lot of work on those, but we also worked with DESE to kind of cut them back a bit and align them with the 3 focus areas. And the bottom line is, as we said to them, and I think it was Mike that said it to everybody, if the turnaround plan has a problem with effective instruction, active reading and writing, and positive relationships, there is a problem with the plan. So
makes sense.
It all lines up, and probably I think that the schools were working so hard on these plans because they were trying to do everything possible. And so if anybody from DESE whispered something, well, have you thought about, oh my goodness, we better put that in the plan.
Right.
So they really, I think you're right, they became really probably
27-page.
Yeah, long documents that were hard to implement. So we've tried to streamline them and tie them to the focus areas, but protect the plan. They worked hard on those, and they've done a lot of work with those. You don't just, that's the problem with education. We're on to yet another thing, and throw everything out. We were not going to take that approach.
Right, good. And you're right, they did work very hard, and those presentations were a lot of time went into them when they presented them to us. But I just was curious about that tie-in, so thank you for clarifying that. That's all I had. Thank you.
Good with everybody else?
Yeah, everybody else good?
All right, that's the end of my report.
All right, are there any items to refer to subcommittee? Mr.
Kidding,
Minicello,
just kidding,
you and I only
just
have a couple
kidding.
of weeks left.
Just kidding, just kidding.
Okay, all right. I don't have anything to refer to subcommittee either. Do we have any unfinished business for the committee at this time? No? All right. Then we'll go on to new business. I know that there are 3 items of new business here. So the first, coming from the policy manual subcommittee meeting earlier tonight. Mrs. Sullivan, I believe you're the chair of that, if you want to give us a report.
Okay, the policy manual subcommittee met tonight, and we reviewed Section L, General School Administration, and Section E, Support Services. The meeting started about 6:08 and ended at around 6:50, and Cynthia Mendez and Judy Sullivan were present for the meeting.
Okay. All right. Any questions about that, or any comment from the other members of that subcommittee? So were there just...
There was a favorable motion to go forward and accept the Section L and Section E.
Okay. So these were updates to those policies recommended
Yeah, the
by
policy
MASC
manual
and
is worked on with MASC, and we update the policies that Brockton Public had from 2012. We're updating that manual.
Some are still from 2002.
Okay.
Yeah.
Wow.
So we took, what we did was combine some of ours in the recommendation from MASC, and then also we have our attorneys review them all before they're brought to policy manual subcommittee.
Very good.
Right, so everything's legal.
Oh, sorry. Want to make sure we're all all up to date and have all the latest language that we need. So, well, thank you to the policy subcommittee for that.
Everybody got a manual in one of the packets, so everyone should have a policy manual at home if they have any questions or anything.
Okay, so then we need a motion on the favorable recommendation to accept those new sections.
Motion to accept policy revised of E and L.
Second.
All right, we have a motion on the floor by Mrs. Mendez, seconded by Mrs. Sullivan. I'm going to call the roll. Mr. Minicello?
Yes.
Mrs. Mendez?
Yes.
Mr. Rodriguez? Mrs. Sullivan?
Yes.
Mr. Sullivan?
Yes.
The vice chair is a yes. Okay, motion carries, unanimous. Then the next item is a discussion and vote of the Accounts Review Subcommittee. And as the chair of that subcommittee, I'll give that report. So the Accounts Review Subcommittee met November 30th of 2021. We met on Zoom. Present for that meeting was Mrs. Mendez and Mr. Sullivan, the other two members of that committee. There were several warrants within those, many different payments to vendors to review. So the purpose, for anyone who doesn't know, of accounts review is, again, we go back and we look at who's been paid and for what and how much. So any check that's written by the district at some point ends up in front of accounts review for review and discussion. Overall, there were several items raised by the members of the committee to get further detail on. We had Mike Bandis with us from the finance office. He was able to provide us additional detail to satisfy the questions of the committee, with the exception of two items. The committee agreed to accept the warrants as they were, but with the understanding that Mr. Bandis would provide us with the additional information we were looking for by the end of that week. Mr. Bandis did do so, and if I'm not mistaken, from the other members of the committee, we're satisfied with the additional information that he sent to us. And so it was recommended by the Accounts Review Subcommittee to accept the warrants as presented. So if I can't make a motion, if somebody wanted to make a motion on that.
Motion to accept the warrants how they were presented.
Second.
All right, we have a motion by Mrs. Mendez, seconded by Mrs. Sullivan. I'll call the roll again. Is there any discussion on the motion? All right. Mr. Minicello.
Yes.
Mrs. Mendez.
Yes.
Mr. Rodriguez.
Yes.
Mrs. Sullivan.
Yes.
Mr. Sullivan.
Yes.
And the vice chair is a yes. Motion carries. Final item for tonight. Discussion and potential vote from the Bid Review Subcommittee. I believe, Mr. Sullivan, you're the chair of that subcommittee. Are you able to give us a report?
Yes, I am. I'll be quick.
All right.
Do you hear me all right?
Yep, Mike's got a microphone.
2021.
All right, try it now. We're gonna start over again.
Okay.
Take it from the top.
Okay. On November 30th, 2021, the bid review subcommittee, the meeting was held on Zoom by BCA. The meeting was called to order at 6:17 p.m. Roll call for quorum was made. We had 100% in attendance. Also present was Mike Bandis from administration. Governor Baker's COVID-19 open meeting law was read, which was also extended to April of 2022. We had one bid before us, fiscal year 2023 food service equipment repair service at $85 per hour, nights and weekends $107.50. Motion was made by Duke Sullivan to accept the low bid, Janco Services, seconded by Mark D'Agostino. Roll call was made. All in favor. There was no other business before the subcommittee. Motion to adjourn duty, Sullivan, seconded by D'Agostino. All in favor. I am making a motion to you to accept these minutes.
Okay, thank you, Mr. Sullivan. We have a motion on the floor to accept the recommendation of the Bid Review Subcommittee by Mr. Sullivan. Is there a second?
Mark, just a minute. Accept the minutes. I got another motion coming.
Oh, all right. Yeah, you're right. All right, so I apologize. That was a motion to accept the minutes. I'm sorry.
Yeah, Sully, we got to vote on the
Yeah.
accepting the minutes first, and then we'll go back to the other motion.
Mr. Minicello, do you still second the...
We're doing accepting the minutes.
Okay, I thought we were accepting the recommendation. I
No, you
apologize.
accept the minutes first and then
Right.
recommendation second, yep.
All right, so we have a motion by Mr. Sullivan to accept the minutes of the Bid Review Subcommittee, and a second by Mr. Minicello. Any discussion? Okay, I'm going to call the roll. Mr. Minicello?
Yes.
Mrs. Mendez?
Yes.
Mr. Rodriguez?
Yes.
Mrs. Sullivan?
Yes.
Mr. Sullivan?
Yes.
The Vice Chair is a yes as well. Motion carries. Mr. Sullivan, the floor is yours.
The second motion is to move this favorable report to the full school committee for its approval. Can I make that motion?
Okay, we have a motion from Mr. Sullivan to accept the favorable recommendation from the bid review subcommittee. Is there a second?
Second.
Seconded by Mrs. Sullivan. Any discussion on the motion? All right, I'll call the roll on that. Minicello.
Yes.
Mendez.
Yes.
Rodriguez.
Yes.
Mrs. Sullivan.
Yes.
Mr. Sullivan.
Yes.
D'Agostino is a yes. Motion carries unanimous. Is there any other item of new business from anybody?
I have a couple quick things. I want to thank the Brockton High Drama Club, Mr. Hogan, Mr. Cunningham, for all the work they put into last weekend's performance of Rumors by Neil Simon. They did a great job. They had 3 performances, so they'll actually go on to compete with the presentation they put on. So I want to thank them as always for the unbelievable job the Drama Club does. And then coming up on Tuesday, December 14th and Wednesday, December 15th is the holiday concert put on by the music department. Both of those nights, again, that's December 14th and December 15th. They both times, they start at 6 p.m. on those nights. And if you need tickets, just let us know. But it's great to have the holiday concert back. And that's it.
Excellent. Thank you very much. And again, to your point, it's great that we're able to have the holiday concert back. I know the kids are thrilled to be able to perform again, and the community's thrilled to be able to see them perform. Right. Any other new business items, comments from the committee? Okay, is that all you have?
That's all I have.
Okay, in that case, we don't have any executive session tonight. Melinda, that's correct? Okay. I will entertain a motion to adjourn.
Motion to adjourn.
Motion to adjourn by Mrs. Mendez, seconded by Mrs. Sullivan. I will call the roll. Minicello. Yes. Mendez.
Yes.
Rodriguez.
No.
Mr. Sullivan. Oh, jeez. You want to stay more?
You can stay alone.
Right?
You can stay all right. Yeah, have fun.
I checked it and then I was like, wait, did he say no? Rodriguez.
Yes.
Yes, okay, thank you. Mrs. Sullivan.
Yes.
Mr. Sullivan.
Yes.
And the vice chair is a yes. We are adjourned.